I am Myla J. Cantoja, a first-year nursing student at Central Mindanao University. Today, I am going to demonstrate the procedures for doping of personal protective equipment or PPE. The possible nursing diagnosis for this procedure are contamination and risk of contamination. The materials needed for this procedure are impermeable shoe cover, N95 respirator, goggles, impermeable coverall, plastic apron, 3 sets of gloves with extended cuffs, alcohol-based hand rub, and bleach solution. Since we're all set, let us start the procedure. Key points in Dolphin Ppe. Number 1, take off PPE in a designated removal area, high-risk zone. Number 2, place poster in the area where PPE will be taken off. Number 3, put all PPE waste in a leak-proof yellow bag contaminated waste. Recommended PPE for trained observers. Number 1, single-use disposable fluid-resistant gown that extends below knees or coverall. Number 2, 2 pairs single-use disposable full-face shield. Number 3, 2 pairs single-use disposable examination gloves with extended cuffs. At a minimum, outer gloves should have extended cuffs. Number 4, single-use disposable fluid-resistant boots or impermeable shoe covers. Instructions for the trained observer. Number 1, remind to avoid automatic actions that may put them at risk. Example given, touching their face. Number 2, read aloud each step of the procedure. Number 3, healthcare worker repeats back the step they are about to perform. Talk back. Number 4, minimize touching healthcare workers of their PPE during the process. Number 5, if contact with the healthcare worker is made, the trained observer immediately disinfects the outer glove hands. Take off PPE only with supervision of a trained observer. Number 1, check all PPE is trained observer reads aloud each steps of the procedure. Number 2, healthcare workers repeats back the steps they are about to perform. Talk back. Number 3, confirm visually that the PPE has been removed properly.
Procedure number 1. Inspect the PPE to assess for visible contamination, cuts or tears before starting to remove. For any visible contaminated, use 110 bleach disinfectant to wipe it off. This is to make sure that the medical workers are safe from contamination risks. Procedure number 2, disinfect outer gloves. Use 110 disinfect for an alcohol-based hand rub, ABHR, to eliminate pathogenic microorganisms and to sanitize before disposing. Procedure number 3, remove apron. Break the apron by pulling from the neck. Avoid contaminating gloves by rolling the apron from inside out. Discard the apron. Removing the gown or apron as described prevents contact with the contaminated front of the gown. Procedure number 4, inspect the PPE again. Assess the PPE for visible contamination or tears. If with visible contamination, disinfect with 110 bleach disinfect wipe. To know if there is a sign of damage or contamination. Inspecting and disinfecting equipment after use decreases the risk of microorganism or infection transmission. Procedure number 5. Disinfect outer gloves. Use 110 bleach disinfectant or alcohol-based hand rub, ABHR, to eliminate or greatly reduce microbial pathogens that those prevent the transmission or disease and illness. Procedure number 6. Remove both covers. Use a hands-free approach by stepping on the back of the cover and lifting the foot. Discard the boot covers by touching only the inner surface of the boot cover. To be disposed and to prevent further contamination to the body. Procedure number 7. Disinfect outer gloves. Use a 110 bleach disinfectant or alcohol-based hand rub (ABHR) to eliminate or greatly reduce microbial pathogens and those prevent the transmission of disease and illness. Procedure number 8. Remove outer gloves. Be careful not to contaminate the inner gloves when removing the outer gloves. Pull the cap of the outer gloves and turn it inside and out. Discard the outer gloves. To prevent contact with the contaminated gloves, outer space, and to avoid contaminating the hands and the environment. Procedure number 9. Inspect and disinfect inner gloves. In case of contamination or tears, disinfect and remove gloves and do hand hygiene on bare hands and put on a new pair of gloves. Use a 110 bleach disinfectant or alcohol-based hand rub (ABHR) to eliminate pathogenic microorganisms and to sanitize before disposing. Procedure number 10. Remove goggles. Left back or strap over your head. Put out and away. Discard the goggles. Handling the trap as described allows removal without contaminating hands, touching only the elastic or mask strings. Protect and glue Protect and glove hands from contamination. Procedure number 11. Disinfect inner gloves. Use 110 bleach disinfectant or alcohol-based hand rub (ABHR) to remove microbial pathogens and those prevent the transmission of disease and illness. Procedure number 12. Remove hood. Unfastened hood is applicable. Grab the back of the hood and carefully remove by folding backwards. Do not touch the inside of the hood to avoid and prevent further contamination. Procedure number 14. Remove coverall. Avoid contact or scrub with outer surface of coverall. Light chin and find the zip of the level of your belly. Carefully trace your fingers up to find the zip tab and fasteners with one hand. Hold the top of the coverall with the other hand. Unzip or unfasten completely before rolling down and turning inside out. Avoid contact of scrubs with the outer space of the coverall. Touch only the inside of the coverall. Touch only the inside of the coverall when rolling it prior to disposal. Discard the coverall. To help the healthcare worker move freely by removing the coverall and flaccid of the next equipment and steps. Procedure number 15. Disinfect inner gloves. Use 110 Blitz disinfectant or alcohol-based hand rub (PBHR) to remove microbial pathogens and those prevent the transmission of disease and illness. Procedure number 16. Change inner gloves. Remove and discard gloves, taking care not to contaminate bare hands. Perform hand hygiene with alcohol-based hand rub (EVHR). Put on a new pair of gloves. Procedure number 17. Remove the N95 respirator. Tilt the head slightly forward. First, grab the bottom elastic strap and then grab the top tie or elastic strap. Remove without touching the front of N95 respirator. Discard the N95 respirator. This prevents the top part of the mask from falling onto chest. The front of the mask through which of the medical worker has been breathing is contaminated. Procedure number 18. Disinfect gloves. Use 110 bleach disinfectant or alcohol-based hand rub (ABHR) to reduce and prevent the transmission of microorganisms among the healthcare personnel. Procedure number 19. Disinfect washable bowls. Sit on a clean surface. Start at the top and finishing with the sole. Wipe down the external surface of the first bowl. Use 110 Blitz disinfectant. Set down the newly cleaned bowl in low-risk zone. Discard the 110 Blitz disinfectant wipe. Disinfect the other bowl. Disinfect the other bowl following the step and using a new 110 bleach disinfectant wipe. Sit down the other newly cleaned bowl in the low rest area. Discard the 110 bleach disinfectant wipe. To remove microbial pathogens and those prevent the transmission of disease and illness and to sanitize before disposing it. Procedure number 20. Disinfect and remove the gloves. Use a 110 bleach disinfectant or alcohol-based hand rub (ABHR). Discard the gloves. To reduce transmission of microorganisms among medical workers and discard the used gloves into its proper waste container. Procedure number 21. Perform hand hygiene. Use alcohol-based hand rubber (EBHR) to prevent the spread of microorganisms. Procedure number 22, inspect for any contamination. If recommend to recall the possible measures have you gone or forgot to the inspect any contamination you might interact with before leaving the area.
Reminders after removal of PPE. Wear the dedicated washable boots and surgical scrubs in the low-risk area. Number 2, shower or at least change clothes when leaving the low-risk area. Number 3, clean the floor of the PPE removal area with disposable cloth soaked in 110 bleach solution after PPE removal is complete. For breaches in PPE, number 1, wash skin with soap and water. Number 2, irrigate mucous membranes with copious amount of water or an eye wash solution. Number 3, report the incident immediately.